Dr. Natalie Marks, and we're here with another quick cup of knowledge. Joining me today is Ken Yagi. He's a registered veterinary technician and specialty in internal medicine and emergency and critical care. He's also the program director of Recover CPR. Ken, thanks so much for joining us.
Thanks for having me.
Let's jump right into Recover. This is a brand new initiative, and as program director, I know you had a lot to do with the kind of discovery and creation of this program. Let's hear more about it.
Sure. My first touch point with Recover was back in 2012 when the guideline was initially published, and we were at the Evidence-Based Veterinary Medical Association Symposium where Dr. Fletcher came, one of the co-chairs, came and started talking about the process of the creation of the evidence-based guideline. And so that was a really exciting thing for us because when we think about it back in practice at the time, I feel like when a patient codes and we call for a CPR to happen and all these people gather and we start doing CPR, depending on the doctor that was present, the staff that was present, the shift that we were on, day of the week, whatever it is, depending on when it would sometimes go really well because we knew each other well, we knew how we performed CPR, but other times when people that didn't know how to work well with each other came together, it didn't go so well. And so we just didn't have this standardized way of performing CPR. And so because of that, when it doesn't go so well, it's chaotic. People are yelling out orders, and there's two people that jump at that at one point, but another order's yelled out, and then nobody jumps on that because the people around us were listening or something to that extent. All of that leading to a patient not surviving is very detrimental to our morale. We feel frustrated and helpless in that situation. And so because I've had experiences like that before this point, when I heard about that evidence-based guideline and a standard that we could create for veterinary CPR, there were a few of us from that practice, and we left that symposium saying, we have to bring this back. We have to put it into practice. And so we adapted that to a protocol that we put into place, so it became a standardized protocol. We were able to convince management that we wanted to do large-scale training, so we trained about 80 different people in Recover CPR and got that going. And one of the best things that we did with that is that we implemented a way to keep track of how well our success rate for CPR looked like afterwards. It looked like it was getting better, and we were selecting the patients that we should perform CPR on better as well. And so as we kept on going with that, Dr. Fletcher and Dr. Bowler and the Recovery Initiative kept on working on creating the certification process, which is when I saw both of them again at IBEX. And I was excited about Recover, so I asked them, can I help with this? And so then they definitely welcomed me to try to help with that process. And so at this conference at WVC, we had what's called a rescuer certification process. So the certification process starts with people taking an online course that gives them the knowledge of how to perform CPR. And then they come in and do an in-person training to become certified as Recover certified rescuers. And then optionally, in addition to that, they can be certified as an instructor if they wanted to, so that they can teach people how to perform CPR. So at WVC, at the Okendo Center, we did the rescuer certification and instructor certification this year. And all of that was full, and people were trying to get in and they couldn't, and so we're trying to catch up on that demand now. But the next opportunity that we have to do that is with WVC is with the Veterinary Technician Symposium that's coming up in June. And so we'll be going through and certifying 120 veterinary technicians that will be coming over for that symposium and taking 3 days to do a session with 40 people, 40 people, 40 people. So it'll be a marathon, but it's very worthwhile. And I think that as we talk to people that are out in the field that have been trained and certified in Recover CPR, they all feel the same way that I did, which was once we implemented it, it was completely different. It was, at least we can call it organized chaos when a code happens and we need to do everything that we can to try to save that animal.
Well, your passion for this is incredibly obvious and obviously has empowered you personally to find this new way to make medicine better and to give back. But as we were talking, I think in general, a lot of veterinary technicians don't feel that way. They feel underutilized or stifled or plateaued in their jobs, and some of, as we've said, are even leaving the profession for some of those reasons. But you have some good thoughts on what's ahead and some reasons that hopefully can help bond this community and elevate them, maybe when they're not feeling they're in that best place in their job.
Right, and so that's always been a focus point for members of our profession, is to how to make our profession sustainable, people are fulfilled in it, and we continue to elevate that profession. So the National Association of Veterinary Technicians of America, or NAVTA, does something called a demographic survey, where they reach out to people who are in the veterinary field, mainly credentialed veterinary technicians, to see what the state of the profession looks like. And they do that every once in a while, every 5 years or so. The most recent one was 2016, and the 2016 survey, when people were asked the question of, are you satisfied with your job, 51% said yes. So only half of us were feeling satisfied. And it also said that 56% of us changed jobs within the first 5 to 7 years, and of that, half of those people left the veterinary field. And so we're losing people from our profession. And the top reasons of that happening come down to things like low wage, lack of respect, not feeling that the credential is valued enough. They're not being utilized in practice for the education that they received and came into this field for. I'm very appreciative of the fact that we've gained so much more focus on how to make the profession sustainable and to make it a place that we are able to enjoy the work that we do and the place that we work at, and think that this is a career, this is a profession, not just a job that we'll do until we figure out that it's not sustainable and then try to find something else to do. And I would say that as we were going around and doing workshops trying to assess people's veterinary practices level of utilization of technicians, that utilization level is pretty darn low. And so we want to push that up and get every practice to be able to utilize the technicians better, so that we can utilize the education that we gained and the training that we had and the experience that we gained to do more and more to help the patients, so that the entire practice can help more patients better.
Well, I think every veterinary technician that's watching this right now is so thankful for you and all that you're doing to move the profession forward and elevate all of those in the community. So thank you for all you do. We're certainly looking forward to the Vet Tech Symposium in June. Have a great rest of the conference, and thanks for joining us. Yeah,
and if I could just add one more thing, is that it's a huge group effort, that there's a great group of volunteer leaders in the field that have come together to be on the NAVTA board, being a part of the Vet Nurse Initiative, all the committee members, and we would really invite everyone else to join us in this effort, be involved, so that we can elevate the profession together.
And it takes a village, doesn't it?
Absolutely, yeah.
Thank you again.
All right, thank you very much.